If you've ever lived before, then you know getting stuck with a splinter feels about as nice as getting flicked in the eye. Welcome back to another episode of UMA Feed. So you've got a splinter. Some people call that a tragedy, I call it karma. You probably had it coming. Anyway, regardless, I'm here to help you with a few tips on how to remove that bad boy. So let's get into it already. Number 1, do not panic. The splinter can smell your fear. Make sure to really inspect it and see what angle it got wedged in there. Keep an eye out for any piece of the splinter that might be sticking out of your skin. This will help you for the next step. Number 2, grab a pair of tweezers, because this part's gonna be really fun. Try to pull the splinter out from the entry wound. Make sure before you do this, you sterilize the tweezers. If you've gotten this far in the video and haven't done this, I'm sorry, you're not gonna make it. Number 3, if you've successfully removed the splinter, good on ya. If you haven't, you're gonna have to try a different tactic. Time to pull a MacGyver. Take a piece of packaging tape and wrap it around the area that's got the splinter. Remove the tape once you've applied it and make sure you're removing it in the direction that the splinter can slide out from. You may have to try this a few times, but it should work. FYI, if you find yourself without tape, kids' craft glue also works. Number 4, if you're still not having any luck, you're gonna have to cut the area a little bit to get the splinter out. I know. If you're anything like me, you're crying at the thought of doing this. But you're gonna have to channel your inner Rambo and just push through it. Try using a sterilized sewing needle to flick open the first layer of skin, get a better angle at that splinter. From there, you should be able to use the tweezers again and be able to pull it out. Be sure to wash the area where the splinter was to avoid infection. And after all this, if you still haven't gotten it out at this point, it's time to cut the finger off. I'm sorry, but you'll just never be able to point again. But hey, look on the bright side, you still got 9 more. But seriously, don't cut your finger off. It's a bad idea.
Information on the feed is general in nature and not a substitute for professional healthcare. It is provided for informational purposes only and is not intended and should not be used to replace the advice of healthcare professionals. You are solely responsible for your reliance on the health-related information on the feed and for all decisions and actions resulting from your use of this information, including not limited to any decision not to seek or refrain from seeking any diagnosis or treatment. If you have specific healthcare needs or for complete health information, please see a doctor or other healthcare provider. If you believe you have a medical emergency, you should immediately call 911.